because if I said you have to be in a schedule, I should do the same thing. Before you heard me, you listened the day before about, but we have clapped the moderators, we have clapped the presenters, somebody has clapped the chairman, I don't know much. No, but I don't want to forget this before, this is the last day, and I was very interested, but sometimes I think we should clap the person who is in the back available for everything. I don't have a computer, I don't have the PC, I need a Mac. Let's give a clap for Frank, who is in the back with taking care of every detail.
Thank you.
Because if not, this would be a real mess, I can tell you. Okay, so today I was speaking yesterday about acute telogen and effluvium. I don't know how much confused you were after my presentation, because I induced confusion many times instead of clearing things. But today we're going to speak about, let's speak, and we had the first three presentations, Maria and Annie and Ibrahim, about innovative therapies that weren't tried before. I think hopefully it doesn't fall down. That's okay. That's okay. Thank you. Yeah. So my presentation today is, and what Svensson is doing with minoxidil is, let's do something who has been used for years in the field of hair, alopecia, and do different applications. So minoxidil and finasteride, as I mentioned yesterday, are the only two medical treatments for alopecia that have a consensus since years, other than the hair transplantation, that's a side of medical therapy, that are really demonstrated efficacy. So in fact, finasteride, for men, they have minoxidil and finasteride. Minoxidil, topical minoxidil and finasteride. But for women, even they only have minoxidil, because finasteride have a problem of teratogen effects on premenopausal women, and it's not been shown a clear efficacy or demonstration of efficacy of finasteride in women after menopause. So what we are doing is, with this presentation, is to explain, we are trying to use minoxidil, which is the only therapy available for women, in different applications, and try to focus, add some efficacy to the conventional topical minoxidil every day, every night usually, or twice a day, and that's the paper about, okay? So, the first part of the paper, which is in the title, the second part is not in the title, but I hope it will be the more interesting for you, is what we decided to do is to apply air compressed minoxidil in patients, this kind of patients. The patients were wearing a hair prosthesis. It's called a hair-to-hair system, or a hair-to-hair integration system, where you put natural hair from somebody else and integrated in the hair of the person, like this example with strong alopecia. And this is very important, relevant, and distressing pathology for women more than for men. So we found that there is some papers working on questionnaires, because it is not only important the appearance, but also the subjective perception of the women. Is not only how I look like to the rest of the people, but how I look myself when I look to myself into the mirror. So the objective of, okay, sorry about that. Hopefully come back. Yeah, here we are. So should I turn this off? I think I can do that. Yeah. Running out of setup. Yeah, it's here. So the objective is to evaluate if, when we say ACMX is air compressed minoxidil, we will explain you which is the method to do that, may improve the self-image satisfaction of the women wearing a hair prosthesis on the remaining own hair perception. Is that important for them? They lack a lot of hair, but they have still some hair. Is that really important for them, or it's just they don't care because they look fine with? We compare 43 patients. First of all, the first part of the presentation is a subjective perception study. It's a questionnaire. There is no measurements, and that I had to be autocritical. By the way, I also should say I work for Svensson. I'm an employee of Svensson, and you can always tell that I have some conflict of interest to show this is. But honestly, I present what I do, and you can make up your mind up about our results. But it's, the control group had only the conventional hair care in the Svensson hair care centers about the readjustments of their hair processes. The second group, every other week, received a dose of air compressed minoxidil at the hair care center removing before the hair processes. So I have to explain a little bit how we do that. We use this kind of machine. You can fill it with 4 milliliters of minoxidil, and then you have here in the left. Excuse me. This a spray applicator to propel the minoxidil into the. It's not an injection, please. It's just to apply with air compression. So this is the principle. How does it work? And how we do that? We divide first we put the hair back to the for not the minoxidil to go inside into the face of the patient, and then divide the scalp in different areas to apply the minoxidil with air compressed minoxidil. So we ask these patients about 3 questions. Is the aspect of your own hair improved? Is the density of your own hair increased? And how relevant? Again, this is a questionnaire, and we are exploring. You can always say this is a placebo effect, and maybe you may be right, but it is exploring. The responses are score nothing, barely, score 2 or something, or much score 4. But the main thing is subjective perception. Has your aspect of your hair improved, increased, the density, and how relevant, how important is for you to maintain that? So there's some repetition. Then we decided, you will see in the study, to add the previous scores obtained in the 2 questions and have a total score. The age of the patients is kind of high, 60 years, 10 males, 33 female. And these are the results. Both groups really concerned about their own hair maintenance, even it's not in a good shape at all, but they concern. They think it's relevant for them and for the self-image to maintain it. And what it shows is that when you applied air compressed minoxidil, the responses are divided. Some people say they improve much, something, some barely. But in the control group, there, as expected, no. And this is significant statistically. The same thing about the own hair density. They think or they believe the hair density is better with applying every other week an air compressed minoxidil, and this is relevant. Again, this is subjective results. The total score is also better for the treated than not treated. You can see here, and that's very relevant difference. There are no difference about, you can say that minoxidil can induce pruritus, and scalp pruritus, and that's very well known, but there's no significant difference between both groups, so you are not doing. The conclusion of the very first part, I'm 9 minutes, so I still have 6. To speak about the second part, that's that air compressed topical minoxidil may improve the self-image satisfaction on patients with hair prostheses by improving the remaining own hair perception. And the limitation of the study, of course, is that it's subjective, and a larger study is needed to further validate. So after doing these conclusions, before coming to the conference, I said, what else I can tell about a new application of a very old, medical therapy. And we are doing that. We just concluded only in 27 patients. These are preliminary results, but this is a different issue. This is an objective study. This is a measurement hair of density, hair count, and I will show you that. We applied air compressed minoxidil to a group of people with male androgenetic alopecia. And so we divided the 27 patients into two groups. One just received the conventional application of minoxidil. We call M5 because it's minoxidil at 5%, once a day during 6 months. This is our control group, excuse me. And then the air compressed minoxidil group was the same thing. They use minoxidil every day at home, but then every other week they come to the Svensson Hair Care Center to receive an air compressed minoxidil application every other week. So the methods important is to use something that you can really measure the amount of hair, the density, and more important, we heard yesterday about that. I wonder if the next presentation will say something also, but the thickness of the hair, because it gives you the volume of the hair for the patient with alopecia. So we use this. The handyscope it's applied to an iPhone. It's used in dermatology a lot for melanomas but we use it to do what you can see now. We have this rule to put on the scalp of the patient and repeat the measurement in a very, very same place before and after the treatment. We have to shave 1 square centimeter and ask the patient if he agrees to do that. And it's in women particularly, but in men also we have some strategies. It's easy to cover the shaving after, particularly they have long hair, but in men we also have some strategies not to, after a couple of weeks. The good thing for them is that they have the rewarding of how much hair I did obtain after the therapy. And that, this is, nobody would like to have for 2 weeks, but you can cover easily, and then you have after the treatment your report of what your therapy has done. What we can do with the iPhone photographies is to have with this Trichology scale software measurements of this is in Spanish, sorry about that, but it gives you the amount of hair, the counting of hair count, density count, and this is vellus, it means thin hair, and this is terminal hair. For many patients sounds a horrible word, but it's thick hair, terminal hair, and folic units detected by the Trichology scale. So it displays also, you can give this to the patient how it was before. This is thin and it improves the thickness. It's good to give them, and we provide them with a report for them of the therapy. So again, minoxidil was used. This paper is from 1998, and somebody was. This is good. This is approved. This is no many side effects. It's safe. I don't know what it is. Maybe it's losing the power or so. But you see in the top of the real people who benefit from minoxidil at 12 months is not much. It is good to maintain, but even there is people who keep progressing the hair loss after minoxidil. That's a very well known among trichologists, that minoxidil response is very variable among different people. So, I can see here. All right. The hair count response was different. You can see here, we divided the response in three. I don't know what this. We divided the response in 3 levels. Oh, okay. Yeah, you got it. Thank you so much. It's okay. we divided the response in 3 groups. Less than 10%, I mean, the progression of the hair loss is going in red, up or below 10%, which is, you could say, a neutral response, and above 10% of hair count after the treatment. This is not reached probably because of the small size of the sample of the patients, but it's almost significant. 0.06 should be less than 0.05, but you can see the difference. What we can say is that minoxidil is adding a therapeutic effect to the conventional use of minoxidil. And this is also in the hair density response because it's calculation. So it's a better response when you add air compressed minoxidil for the hair density. And most important than that is that the terminal hair, I mean the thickness of the improvement, and that is significant. You can see here less than 0.05 is significant. The terminal hair density response is better when you use air compressed than when you as compared with the conventional use of minoxidil. So as conclusion and finishing in time is that air compressed minoxidil application may increase the therapeutic effect of home-based minoxidil therapy in male androgenetic alopecia patients. Hair count, total hair density, and terminal hair density show the higher positive response in minoxidil plus air compressed minoxidil patients as compared with just home-based minoxidil treated patients. And thank you very much for your attention.
There are any questions? Yes.
Thank you, Dr. Nicolas, for this nice presentation. There is one question only. There is some patient, especially in the male, they have a concern about using the minoxidil. They said even sometimes if it's used topical, it may cause some testicular atrophy. Does you report any case from your study?
With minoxidil?
Yes, topical.
Finasteride, because it works differently than minoxidil as anti-androgen. It has been described, what you mentioned. But minoxidil has been treated for years. For 20 years, there is no report about it. It is pruritus sometimes, and sometimes they change the color of the hair with long-term use. But the testicular complication, that's finasteride, not minoxidil at all.
Thank you very much.
Yes, I never seen it.
Nice presentation. I would ask how much it costs for patient to come every time to you for this procedure, and because it's very time consuming, how they can afford. If I have, for example, 20 patients a day, and they all should come twice to apply minoxidil, or how you realize it in the life?
You're perfectly right. First of all, for the first part of the presentation, the hair prosthesis patient has to come to the Svensson Hair Care anywhere because they need to progressively fix adjust the prosthesis to the hair, and that's been done by a technician. So they have to come regularly. But you are right. How much? You are asking me about the cost for the patient?
About costs of the patient and how you do it really in real life. How often they came?
Yeah,
yes.
Yeah. Well, we sign it's like a purchase for them. It's like 6-month period therapy. They can also pay for a 12-month therapy, and this is for the 7. I'm not very. We doctors in Svensson are aside of the commercial. I mean, we advise and we, make the supervision, and we do prescriptions, but we do not enter in the. I think it's like around 700 euros for 12 months, and then they come every other week. The receptionist of the sometimes it's not the exact day, but usually every other week they come for. This is a 5 to 10 minute session. You don't need to spend there an hour. So also it depends on how efficient is your your receptionist and the commercial staff to organize and to agree with the patient. You have to come every other week, but this is a short session of 5 minutes of air compressed minoxidil application. They don't need to spend many time in the center. They have to be available, but that's the good thing. We have 9 centers in Madrid, 39 centers in Spain. So they can go back and forth. That's a benefit of expansion to have so many centers for them.
So if I understand right, you have to apply minoxidil only twice a month?
Yes, air compressed. They use the conventional therapy, as you're a trichologist, and you know much more than me about that.
Yeah.
They use minoxidil therapy at home every day, and then every other week they have what we call, you know, as air compressed session at the center.
Thank you very much.
Congrats, Nicolas. It's an excellent presentation. I was very excited to hear you about air compression with minoxidil, because really I use air compress for many years, but much more in other indication in areata alopecia, with air compress with corticosteroids. And the results is amazing, because of the difference that you have when you apply topical corticosteroid or with air compress. Just one question. It's painful for the patient?
Not at all.
No.
Not at
they
all.
have not
Not at all.
nothing.
It's not like mesotherapy. It's not.
Yes.
You know, some patients have pruritus. We use foam minoxidil.
Exactly.
Foam minoxidil. If
This
they
is
have
my second
pruritus,
question.
but sometimes they have pruritus at home also. So and then we use the same minoxidil they use at home. We use to fill the machine.
You are using the same. It's a topical solution.
Yeah.
Because I can understand that is provoke pruritus, because it's an alcoholic solution,
Yeah,
because you know that is very unstable, the minoxidil in the formulation, and it's alcoholic solution.
You're
and
right.
Maybe the pruritus
You're right.
is
Most of the patients use a brand, you know, not prescription needed to use minoxidil at home in Europe. And then if they complain about pruritus, you always can ask a pharmacist to prepare foam minoxidil, because foam
Yes, I
minoxidil
know.
in Europe is not commercialized, but you can prepare
Exactly.
it. And once you put I agree fully with you. The pruritus is not because of the minoxidil, but because of the
yes, the vehicle.
Yeah, the vehicle are
Nice.
irritant for the scalp.
And
Once
really
you put
you
them on
have-
foam minoxidil, 5%, pruritus is gone.
Really, you
Both
have a
at
very
home and
good trend.
Both
in
at
the
home and in the
results.
sessions. Yeah.
It's a very good trends in the results. I like it
Thank
a
you.
lot. It's a off-label use.
You're right. It's off-label, and the authorities in Spain ask us to have a signed consent between the doctor and the patient.
Thank you so much, and I give you your certificate from Omics.